So, attunement is by far, I believe, the most important therapeutic skill that you can develop. It really establishes a profound sense of safety. When our clients feel seen by us accurately, they feel safe with us. It initiates the process of co-regulation. I think it's actually the first step in co-regulation. And it affirms your client's humanity. It lets our clients know that I see you as you are and I'm welcoming you as you are. And it really creates the necessary openings for deep transformation. So, attunement is defined as the process of being highly aware, receptive to, and emotionally in sync with the needs or feelings of yourself or someone else. And when we're in a transpersonal space, to me, this feels like resonance, like honoring that in my humanity, I have access to some sense of what you're expressing. And I'm going to attune to you from that place inside of me that can recognize that this is an integral part of your human experience. So it really provides the emotional safety that allows a client to feel deeply seen and understood and connected. And our attunement brings awareness to what is present when we're working within a transpersonal or and Gestalt framework. We're really working in the here and now. And a client's present moment expression, when we're attuning to that present moment expression, we are present with them as they are. So it's an invitation into presence, it's an access point to presence, and it's really teaching the clients to listen to their own system, which is not only where transformation begins, but where they will learn to regulate their nervous system and where they will learn to be responsive to their own emotional experience. So once they see what they're experiencing, the next step is then learning how to be responsive to that emotional experience. So I want to just describe what transpersonal is, just in case it's a new term for anybody who's here. Transpersonal literally translates into beyond personal identity. And what that means is that we're not engaging with our client's personal identity from our personal identity. So in the case of attunement, if I was in my mind, like interpreting or analyzing my client as a separate other, I might I might say like, it seems like you're holding your hands together right there. And I'm just wondering, what are your hands saying? I can say the same thing from awake awareness, but from personal identity, it's like I'm seeing my client as an object to analyze or understand rather than meeting in the transpersonal dimensions of non-duality. Um, in transpersonal, we're working with awareness-based knowledge. So we're seeing our clients as accurately as possible without trying to fix them or change them. We're working within the receptive quality of awareness rather than the generative quality of the mind. And we're honoring that all symptoms that the clients have are adaptive and not pathological. And this is so important, that every single thing that a client experiences is adaptive and holds a wisdom that when we attune to whatever that is, whether it's like tension in the throat or disassociation or something else, that we don't see it as bad, we don't see it as pathology, we see it as an adaptive response that we're here to learn from and honor. So the Gestalt lens works within the present moment, here and now, and really utilizes a nonviolent, mindfulness-based approach to whatever arises in the space. I think of our role as therapists as often our interventions are teaching our clients how to be mindful with themselves, how to shift into the witness rather than staying hyper-identified with the mind. Excuse me. Another key aspect, and this is all really as it relates to attunement, but another key aspect is the paradoxical theory of change, which states that true change occurs when a person becomes truly who they are, as they are, not when they try to become what they are not. And I like to say that we need to live within the paradoxical theory of change to really create the conditions for a client's organismic self-regulation to come online. And attunement is part of that. Seeing our client as they actually are and welcoming them fully as they are teaches them, in essence, to do the same. And we're creating a therapeutic container that really holds that theory as a foundation. Excuse me, sorry. Another piece to this is the I-thou relationship. The I-thou relationship is a term coined by Martin Buber in the early 20s. He was a philosopher. And it's this idea that we are meeting soul to soul, whole person to whole person, mutually affirming our client's humanity and creating openings for pure awareness. And this is really where we dismantle the old paradigm of therapist as expert. And we stay in what's known as dialogical relationship or authentic engagement, where we're fully here with our clients. We're not assessing them or teaching them or trying to figure them out or change them in any way. And then my favorite concept is the Taoist root that really is embedded in Gestalt theory, which is the concept of wu wei, or effortless action or non-forcing. And when we are in this effortless action, rather than trying to manipulate or be clever in some way, we're really aligning with the natural flow of the client's system. And it's really quite obvious when we're not in effortless action, because this is where we get depleted. This is where we feel stuck, where we're not fully welcoming what's here. Well, I clear my throat. Are there any questions about these concepts before I move on to attunement? Okay. So our attunement really is that accurate witness. So we're acting as a mirror for our clients to see themselves as they actually are, supporting a shift from hyper-identification to clear witnessing. And when we do this, as I was saying when we were opening, before I started sharing this PowerPoint, that when we are an accurate witness, we're honoring our own self as seers and really honoring that our any place inside of us that's hesitant to say something to our client, that thinks the client might feel judged or is afraid of causing a rupture. And so we don't say what we're seeing. And these are things I hear all the time. They're things that I experienced earlier when I was a newer clinician, that we're like reliving those old childhood experiences. And so it's really important to honor that, inner young one who didn't feel safe and find a way to create a sense of inner safety that allows us to really be the clearest sense of mirror that we can be. And this is really about creating a sacred space for our clients to heal. So reclaiming the site is really essential to cultivating a deeply healing and sacred therapeutic space. So to the language, might be the most important slide, because I find that language can be so challenging when it comes to attuning. So I think it's important to find language that is descriptive and neutral. So you're acting as an impartial witness. So for example, let me think of an example. If a client seemed really agitated, because you asked them what they were noticing. This is something I hear all the time. You ask them what the client is noticing right now, and the client seems agitated. Finding words that doesn't incite this idea of like, I'm judging you for feeling agitated, or you shouldn't be feeling agitated. Finding words that like really welcome agitation or resistance, or however you might be seeing that in the moment. And not seeing anything as either good or bad, like really holding that non-dualistic perspective of everything that's here, creates a sense of safety for the client to fully come into their experience wholly. Non-judgmental and non-dualistic language, it's similar, descriptive. Just for a moment, I'll say descriptive. When I say that, I mean not pathological. Even if a client is disassociated, I wouldn't use the word disassociation because it's clinical language that's pathologizing. I might say something more like, it seems like you've left. What do you notice about yourself? Because I'm just describing what's happening as neutrally as I possibly can. Um, but really recognizing that nothing is neither good nor bad. If a client keeps circling around the same thoughts, if you say it seems like you're circling around these same thoughts from a place of judgment, the client will sense that. Their amygdala will feel that judgment as a threat. And so really from your whole heart, just seeing, like, I see the circling that's happening here. What do you notice about yourself? It's communicating to the client, I just want to make sure I'm seeing you as accurately as possible so that I can welcome you as you actually are. Not, I want to make sure I'm seeing you so now I can change you. And that one nuance makes the biggest difference in the receptivity of our attunement. We're also creating spaciousness with our attunement. So we're giving space to whatever is present. And sometimes that's through our language. I like to use language like it seems like there's some agitation here, as opposed to you seem agitated. Because when I say you seem agitated, I'm now more in that it, and I'm looking at you as a separate other. But when I say it seems like there's some agitation here, I'm just making room for the feeling or the sense of that together, like in a collaborative way, not in an otherizing way. Another way that we're creating spaciousness with our attunement is when a client is in a big experience, um, dysregulation or habitual thinking, so on and so forth, they unknowingly or knowingly believe that that is who they are. So their sense of identity is seated in that. And so when we can use our awareness to attune to what's happening there, we're inviting their awareness to come into that place too. So now they're the witness of their experience rather than having their identity seated in that experience. Another important part of this is ownership language. And in Gestalt therapy, we talk about meeting the client at the contact boundary. I talk about it as a sacred boundary because to me, it's such a sacred meeting place between myself and my clients, and I never want to cross over that boundary or violate it. And one of the most common ways that I see clinicians violate that boundary is stating that what they're seeing is truth. And so by using ownership language, we're just saying that, to me, it seems this way. And that is also part of that dialogical relationship where there's room for difference. So if I say to my client, what do you notice about yourself? And the client says, I keep thinking about, X, Y, and Z that happened. But what I'm noticing is they have this sense of restlessness. Then I might say, yes, and as that's happening, I also am getting the sense of restlessness. What do you notice when I say that? That's a way of making room for difference because I'm seeing restlessness, the client's attention is there. Both of those things are welcome. And I think that this gets lost in a field that really thinks that being client-led means following the client's mind around as if it's truth. And I think to me, being client-led means that I'm honoring my client's sovereignty and wisdom as the guide to healing. Confronting those thoughts or confronting incongruence or bringing a deeper awareness to what is happening just creates more openings for depth. And then lastly, which I've already alluded to, but having a really heart-centered intention when you're communicating. It's just important to constantly be communicating to our clients. I want to make sure I'm seeing you as accurately as possible so that I can welcome you fully as you are. Okay. And then the last thing I want to say before I move on to the actual 6 elements of attunement is that when we're attuning with our client, we're collaborating with their self-attunement. And one of the ways that we do this is with the awareness continuum. And I'm not going to go into the awareness continuum fully, but it's important to recognize that our awareness, collaborating with our client's awareness, is what creates this really dynamic, alive container. So as we attune, we then pass that awareness back to the client using a present-focused awareness continuum question. And so we're moving from our descriptive neutral reflection to an awareness continuum question. For example, awareness continuum questions are always present moment, open questions that begin with what or how. So for example, what do you notice about yourself? This is one that I like because it invites a more meta view, like a client who's, let's just say, blaming everybody in their life for something. What do you notice about yourself as you're talking about that? Like, I want to know that they have the self-awareness to say, I notice that I keep blaming everybody in my life, or I notice I'm very defensive, or what do you notice in your body, or just simply, what do you notice? So it's always an attunement followed by an awareness continuum question. And I'll often hear from students, when I ask a client an awareness continuum question, they don't know what to say. And I find that if you start with attunement and then follow it up with an awareness continuum question, it has more depth than just simply asking, what do you notice? But I will just say quickly that when I'm working with a new client, if I ask them what do they notice that for the first time and they seem shocked and like they have no idea how to answer, I will say to them that this is a question that I'm going to ask often because I believe that your awareness is the catalyst to your transformation and there's no right answer. So I share my why and then I leave it open and then there's just a tremendous amount of relief. So that's just a little tip with the awareness continuum. Okay, so let me check the time here. Great. So attunement really is a clinical bridge. It merges the transpersonal depth with the immediate real-time demands of the therapy room. And what we're doing is we're tracking and harmonizing across multiple distinct dimensions of human experience simultaneously. In Gestalt and in transpersonal counseling, we're honoring our clients as multidimensional beings. That's what makes this such a powerful system of psychotherapy. And we're also bringing in this sense of responsivity, which in Gestalt terms we would call self-responsibility. But I like the word responsivity because I'm wanting to teach my clients really emotional intelligence to be aware of what they're experiencing and learn how to respond to that experience. Nervous system regulation is really about learning how to stay connected to yourself in moments of arousal. And so by having a client like decide for themselves what it is that this experience needs from them right now, they're learning how to stay connected to themselves. And this is really what nervous system regulation is about. So the first facet of attunement is physical attunement, and these are sequential from what I think are easiest to more challenging or high level. So physical attunement is this concept of tracking observable bodily cues, which help to map the autonomic nervous system in real time. So it might be a client's posture or micro expressions, breath, tension patterns. An example would be a client is speaking really calmly about a work conflict, but their their right fist is clenched as they do, and then their breath becomes shallow. And so we just reflect as you describe that meeting. I see your right hand is clenched. What do you notice there? So just attuning to that physical movement and inviting the client's awareness there also. And then if the client says yes, I would just invite them to bring more awareness to the hand, see if the hand has anything it wants to say. Like if your hand had a voice, what would it say? Which is called explication. Or just seeing, is there anything your hand needs from you right now? Or I would just invite them maybe to even just let their hand be clenched, because again, I don't want to change what's here. I just want to bring more awareness to what's here. Now, as you're tracking and attuning to the physical, let's just say it's a tension pattern, and you can really see that your client's jaw is clenched or their shoulders are clenched. As you're inviting the client to bring awareness to that tension in their body, it's really important to allow your awareness to stay attuned right there also, and to listen with your whole being also, to listen to what those muscles are saying, to really be with that experience, because that will start to amplify for the client also to be able to see more clearly. It's like when we're all meditating on one thing at the same time, it amplifies. And it's the same thing in this relational meditation of therapy, that when we're attuning with our whole self, all of who we are, and our client is attuning also to that same aspect, then we can start to hear the wisdom that's being held in that tension pattern. And you might be able to see the movement or the catharsis or the softening that could happen when the client begins to be responsive to that tension pattern rather than resisting it or ignoring it or shaming it. Just want to check in and see if there's any questions. Okay. So the next one is emotional attunement, which again, I think is one that we probably all know quite well, but it's capturing the exact emotional texture that's just beneath the surface. So this might be visible to you if you have the capacity to see subtle energy, or it might even be visible to you if it's your client's tears, um, or like maybe their face is flushed or something like this. It might be felt or sensed in the nuance of the relationship. An example would be a client describes a loss, and as a wave of emotion arises, it seems to be pushed down at their throat. And this is a common pattern, emotional pattern that I see in clients. I'm imagining we all have seen this, where a big wave of emotion starts to arise and the client just caps it right there, like trying to keep it off. So then we can just say, I see this wave of emotion and it seems like you're capping it off in your throat. What do you notice in your throat? So we're just wanting to let our client know, I see you as you are. I want to know, is this how you see yourself? And then if the client says yes, we can invite them to just turn towards their throat without trying to fix it or change it or figure it out. And just see if there's anything the throat wants to say or anything it needs. So just like really learning to be with what's there in a way that's honoring and nonviolent of the experience. I think that's all I want to say about that. So energetic attunement is tracking the changes in vitality and the expansion or contraction of energy across the body, mind, and meaning making. Now, energetic attunement is a little bit more nuanced, and so it really requires that we're present. We aren't seated in our ordinary mind. We're holding space from that more receptive quality of our awareness-based knowing, which is just more intuitive and sensitive. Um, an example would be a client's talking about being hard on themselves. And as they're talking to you, the energy seems in their heart seems dense, or you feel pain in your heart. Right? That's often a common place where we start to feel the energy of what's there. And so you might say to your client, as you talk about being hard on yourself, what do you notice in your heart? So your seeing or your feeling might just direct your awareness continuum question. Or you might say, it seems like you're holding a lot in your heart right now. What do you notice there? Just to bring more attention to the heart. And then again, just encouraging that self-responsivity, just inviting them to turn towards their heart and really listening to what their heart is holding. And this is where the openings for depth and transformation really start to happen. Are there any questions about energetic attunement? There's so many nuances here. I'm just also trying to think if there's anything else I want to say. Mhm. The one thing I do want to say is that um, I wish we were all in a room together so I can see a show of hands. But if you can see energy in this way, um, your clients will, in all likelihood, feel so seen by you. I find that energetic attunement is the one where clients feel most affirmed in their humanity. Like I've had clients say to me, it's like I'm real. How do you see that? You know, I feel like I'm actually real right now. And so when we're attuning in this deep way, the client's vitality can begin to unlock and they find their organismic self-regulation and they sort of just start to find their way through their inner map in a very deep and beautiful way. Okay. So cognitive attunement is also really important. Nonviolent communication, I think this is what is called empathetic listening, and that is part of this also. But in Gestalt therapy, we're wanting to map our client's inner world. And so attuning to their mind is actually really powerful. And I think that this is part of attunement that gets ignored because we're most commonly thinking of emotional attunement when we think of attunement. But especially for clients who are highly intellectual or deflect and like turn away by following the thoughts of their mind and have a hard time being really present, meeting them where they are without forcing them to be in their body really creates a sense of safety and honoring that that moving away holds a wisdom, that that intellectualization holds a deep, deep wisdom. So we're mapping out the client's inner world with our attuned, empathetic reflections. There's so many ways this might look. I like to call it like we're taking a guess at their why, or we're listening for the deeper need beneath their thoughts. So an example would be a client lists resentments about their partner and then immediately minimizes it. But it's okay because they do so much for me. So a reflection might be something like, it sounds like this has been really hard and you have a need to feel okay with what happened. What do you notice when I say that? Another another option might be, it seems like you're discounting your experience. What do you notice about yourself? Um, there are so many different ways that a client's meaning making really is expressing something deeper for us. And if we stay at the level of reflections that's just about the meaning making itself, and we don't go deeper to what that meaning making is expressing, then we can stay sort of stuck at this level with our clients. And they might have a hard time going deeper. And this is the most common place where I see new clinicians get stuck is with clients who are really, really in their meaning. And finding that way in to create openings for awareness can be challenging here. Are there any questions? It's the same quality of responsivity, but what I love about this responsivity is we're just going to invite the client to bring awareness to their mind, whether that's seeing seeing the mind, like the part of that mind that wants to feel okay, or that habit of discounting themselves, just bringing more awareness there. So we're actually inviting them to attune to their mind too, without trying to figure it out or fix it. And this is where it's like a deep sense of focusing on the mind from the witness that can create so much uh, opportunity. Clients can have epiphanies here, um, or a big emotion that is beneath all of that might come online. Okay. And then the fifth level of attunement is transpersonal attunement. And this is listening beyond the individual ego to the collective, the archetypal, or shared consciousness in the room. So an example would be a client touches a deep loneliness and an ancient sort of universal grief fills the room that feels bigger than just their personal story. It might feel ancestral or collective. Um, and so to attune to that, we just say, it seems like this weight is anxious. yeah, sorry, ancient, like it's older and deeper than just this moment. What do you notice when I say that? So we're attuning um, to that, like what is here is bigger than you. And I think it's really important that our clients never process what is not theirs to process. For example, like some part of this grief is theirs, but not all of it. So when we try to process all of it at once, it becomes overwhelming, right? And it's just too much. And I think that that's true for all of us, like that we're not the emotional processors of this world, that it's important that we just process what's our own to process. And so by attuning to this piece, it can make that more clear so that the client has more opportunity to process what is theirs. So if they say yes, we can invite them to feel into that ancient quality of the heaviness or sense into the lineage of what's here, maybe even sense into their ancestors, like where the pattern began, um, depending on what seems true to them. And then lastly, there's the relational attunement. And this is what I call countertransference as intuition in disguise. I think that when we use our own internal landscape, honoring that this might be projective identification, that's like information sort of broadcasted subliminally from the client's unconscious, we have an opportunity to hear the client deeply. And I think that for those of us who are deeply sensitive and we're working transpersonally, this happens more often than not. So projective identification is this idea that anything that a person is unable or willing or unaware of to when they're unable to feel or unaware of that it's there inside of them, they unconsciously induce that into the people around them. And um, it could be all of a sudden we're sitting with a client and we feel judgment or we feel frustration or we feel tired or bored, or we feel like we want to rescue them. Anything that is different from how we felt before we sat with this client is information about the client's inner world. If we attach to it from our personality, it becomes ours to process. And just like I was saying before, it's not our job to process our clients' emotions for them. And so this is really about learning how to give language to something that might seem very elusive, that's in the implicit field that we're sensing and intuiting, but isn't quite clear in the explicit field yet. So an example might be a client um, details their achievements, but suddenly as they're talking about all these things they achieved, we feel a sense of hollow dread, like it's overwhelming. Um, and so we might say, as you're sharing these achievements, I'm sensing some dread. What do you notice when I say that? So I wouldn't say I feel dread when I'm listening to you, because that would be attaching to it from my personality. But I'm attuning to that deeper implicit field of what is unsaid. And a client might say, yes, I do. I feel very excited, but also dread of how much there is to come, which is something that I've heard from many clients over the years. And so we can just invite them to turn towards that, the duality of that experience, that there's both excitement and dread here, right? It's not about one is better than the other. It's not about telling them, oh, but there's so many great things happening for you here. And it's also not just about being with dread and prioritizing going into the darkness. It's about welcoming all of it, all the dimensions of the client's humanity. So lastly, I just wanted to share this sequence again with you. So attunement, followed by the awareness continuum, and then self-responsivity. And this sequence is really the starting point for alchemizing stored emotional energy and unresolved experiences into integrated healing, self-authorship, and lasting change. So we're really creating openings here, which is what we're always wanting to do, to create openings for awareness. So your therapeutic attunement creates the opening for your client's awareness to expand and ground and safely take root. It also is really honoring that everything a client experiences, every symptom, defense, and emotion holds an inherent wisdom. And it's also honoring that a client's own awareness and innate wisdom are the ultimate guides of their transformation. And so I'll just share quickly, this is the reference page.